This week you'll be getting into the actual practicing of modalities, and we start with cryotherapy. I encourage you to practice these 5 modalities in this category on yourself so that you know what it feels like, what the patient is receiving. It also helps when you do some of your assignments, your written assignment, you're better able to respond to the questions. This video is not going to be very long. I just want to point out a few things. The book covers it really well, so make sure that you take good notes on your study guide. One point that I want to make is that right here in red, that ice does not reduce edema or swelling that is already present. So you'll hear this at the physicians, you'll hear this from nurses, that if you have swelling, you should put ice on it to decrease it. But a change in temperature cannot decrease swelling that is already present. It can prevent swelling from accumulating or for coming. So in rehab, we'll oftentimes use ice right after a rehab session or exercise to prevent swelling, or right after an injury to prevent more swelling. So that's why we want to get ice on there right away. But once it's swollen and so maybe a few hours after an injury and you notice that a joint is really swollen, putting ice on it is not going to decrease the edema. Your compression and your elevation are the best ways to decrease edema post-acute injury. I also have on your notes, I just want to scroll down and make a reminder here that on your study guide I state that I'm recommending that you make 3x5 information cards for each modality. So you would have 5 cards in this week, and you would write down what are the physiological events that take place during cryostretch, the advantages of using this mode of cryotherapy, the disadvantages, indications. When would you want to use cryostretch versus the other ways of decreasing or of cryotherapy? What are the contraindications for cryotherapy? Those are in your book, and compared to what are the precautions. And then some of these might have some maintenance or safety issues. For example, the Game Ready, you need to make sure that the cords are checked, they do plug in. You want to avoid shorts of any kind that could cause harm to the patient. And then also be sure to read the modality myths boxes in each chapter. Some of the material for the exams come right out of the modality myths, and you'll want to be familiar with those. So everything else in the study guide should be well covered in your book. So hopefully that you'll understand the material, but if not, send me an email. Thanks. Have a good week.